Well, hello everyone, and I will go ahead and start. Mary, are you recording this as well?
Yes, I am.
Okay. Happy Friday Eve. I want to welcome you all to today's call, Social Connecting While Physical Distancing, intended to learn new innovative ways to re-energize your activity programs while adhering to state and federal regulations. After today's call, we hope you have many takeaways to begin and share with your facilities. This is a regional call among our partnering states, so I want to add the disclaimer that our states may be in different phases in which regulations differ, and ultimately it is up to the discretion of the facility to begin implementing the reopening of nursing homes. Please check with your nursing home administrator starting any new activity program before starting any activity programs in your nursing home. On today's call, I would like to introduce our nursing home contacts for each of our states. My name's Crystal Morse, and I'm from Wyoming. Marcy Gallagher is my co-facilitator today for today's call. Marcy, you want to say a quick hello?
Hi everyone, welcome. Thanks for joining us today. And I am, as Crystal mentioned, her counterpart for the long-term care folks based out of Helena, Montana.
Thank you, Marcy. Is Mark or Maggie on the line from Hawaii? How about Lisa from Alaska?
Hi everyone, this is Lisa Johnson. I'm with the Mountain Pacific office in Anchorage, Alaska. Greetings.
Is Mary Erickson on the phone? Okay. And we still have people coming on the call, so sorry that if you're entering late. So just a couple of the quick logistics. So if this is a Zoom call, if you can, please mute your telephones for the presentation. As you know, background distraction causes frustration and can result in others to drop off the call. We want this to be a positive experience for you all. Our flow today will be informal, so please feel free to comment by unmuting your phone or use the chat as much as you like. We have plenty of support from Mountain Pacific on the line to ensure your questions and comments are addressed. And please be patient. We're all at levels and comfort with Zoom. So if you're having difficulty, please use the chat. We can converse with you privately to help troubleshoot any problems you're having. And I do know Marcy Gallagher put the call-in information in the chat in case you're having video or microphone difficulties. Didn't get it all today? Well, don't worry. The call will be recorded and sent to all participants afterwards. This is a sharing call among the group, so interactive conversation will be very important. Wyoming is fortunate to have an association in which Mountain Pacific has had the pleasure to partner with. A special thank you to Don Worman and Brittany Hull of Wyoming Activities Coordinators Association, or WACA. They're for the boots on the ground and the efforts to help us coordinate this call today. So I'm going to introduce Dawn, who's the president and panelist for today's call. Dawn, would you like to introduce your board and tell us a little more about WACA?
Hello, guys. I'm Dawn Worman. I am the president of WACA, and then with me I have Diana Perniger. She's the vice president. We've also got Terry Newman. She's our education person. Mary Sue Williams is awards and marketing. Brandy Greer is our secretary. Diane DeYoung is our treasurer, and Brittany Hall is our IT coordinator. WACA started in 1979, and at that time we've only had one workshop, and as of this year we've done, we do 2 a year. So we have a spring workshop that's usually 1.5 days, and then our fall one is 1 day. then when we also started, we only had 15 members, and Nancy DeBolt was one of our first members, and she was also the first class that started at Casper College for our activity professionals. So it's been nice that we get together and we share ideas, kind of almost like our Zoom thing today. It's kind of like our board gets together also and is able to do these conferences. And we keep in mind of what types of areas that people are struggling in that could use more help with. And we base our workshops kind of around that to be able to help our peers grow in their departments also. So.
Well, good. Are there any other board members on the call today?
Diana is here with me, and Brittany should be here, and also Mary Sue should also be trying to join in. So.
I'm here.
Diane, Diane.
Yeah.
Oh, Terry. Oh, and Terry's here. Great.
And
Yep,
Diane.
I'm here. Yep.
I'm here.
Okay, so I think so is Brandy here? So Brandy and Diane, I think maybe the only two that are not joining us today.
I'm actually on.
Oh, she is here. Okay, good.
They all.
Well, good. Thank you again for the support. And I know that you are on Facebook, and I've started to follow your Facebook page. So do you want to let everyone know about that?
Yes, so we have the Wyoming Activities Coordinators Association Facebook page. We have Terry and Brittany that are co-host that and are the admins for that. We share all sorts of activity ideas. They are able, other facilities are also able to send in posts and stuff like that. And it's also just a good marketing tool. So, I mean, if people would like to like our page, that'd be great. We get lots of fun activity ideas and stuff like that. That it's kind of like, oh, you know, I never thought of that would work. So it's great to have that support also from Facebook.
Thank you. And again, thank you for helping coordinate this call today.
Not a problem.
So today's objectives. So we're going to talk about who Mountain Pacific is and what we do. Marcy Gallagher is going to give us an update on the phases of nursing homes. You may or may not know which phase you are in. So Marcy's overview will help you understand this. And then the meat and potatoes, the information sharing, the best practices, the stories and successes. We want to hear it all. On the flip side, we can also listen to what is not working and help guide our peers. And lastly, our team will work towards developing a handout that highlights all your wonderful ideas shared today. So you'll receive this along with the recording and other information we feel will be helpful to you. If you don't see any objectives that you were hoping to cover today, please let us know by typing in chat and we'll help get those addressed. So Mountain Pacific has been around nearly 50 years. We serve Montana, Wyoming, Alaska, Hawaii, and the US Pacific territories. Our business is simple: quality improvement. We are tasked with improving behavioral health, patient safety, chronic care prevention, improvement in care transitions, and nursing home quality. We work to engage providers to share and spread evidence-based practices across facilities and other healthcare settings to make sure residents and patients are safe, healthy, and getting the best possible care. We encourage collaboration among providers and other community stakeholders that leads to the exchange of ideas and other people's experiences and expertise, ultimately helping lower the healthcare cost. And we empower and assist patients and families to be engaged not only in their own healthcare, but help them navigate a complicated healthcare system. Let me introduce one of our newest initiatives, cleverly named Powerful Partners Plan. Mountain Pacific has added volunteer patient and family advisors to our team. With the addition and the influence of patient family advisors, It's become the way we do business. And the conversation now shifts from what do healthcare providers need to do for the patient to what do patients and family need from healthcare providers. Do we have any of our patient family advisors on the call today?
Don't think so.
Okay. Well, if so, we want to thank them for what they do because they have really helped us in moving healthcare initiatives forward with Mountain Pacific Quality Health. So I wanted to recognize them if we had any on the call. So what is a QIO? So that Mountain Pacific is what's considered a QIO, and it stands for Quality Innovation Network, Quality Improvement Organization. There are 12 across the nation, and we are under the direction and funded by CMS. So we want to know who are you representing here today? So we are going to bring up a polling question here shortly. Thank you, Mary. And if you can, please answer who you are here representing.
Assisted living.
Also, feel free to enter in chat if you're unable to.
I don't know if we would put it under other or not.
And Crystal, while we're waiting for the chat, Eileen Ford says
Auxiliary.
you got one of your advisors.
Who? I'm sorry. What did you say, Marcy?
Eileen Ford.
Yes, she
I
is
don't
one
know.
of
Which
our
one?
advisors. So
Is it a place to type in the other?
I see we still have some voters out there. So
And we are seeing some comments, Crystal, that some are from both nursing home and assisted living and A and B and transitional care. So
This is Joanne Cobb from Pondering Medical Center. We have a nursing home connected to the hospital, so we do acute and swing bed as well.
okay. So it looks like nursing homes are in the lead right now, which is where this call was directed. So
This is Carrie Newman, and I'm from assisted living. Actually, I live in Wyoming and work in South Dakota, so assisted living.
Oh.
And we have 2 memory cares, so just, yeah.
well, thank you, Terry. Thank you for joining all the way there too. So it looks like our polling results are in, and 75% are from nursing homes. So assisted livings, followed by assisted livings, independent senior housing. Who is representing other? Can you share?
My friend Ann Ferris with Alzheimer's Resource of Alaska. So I believe we got a couple of folks from the Alzheimer's Resource of Alaska team on the call today.
Okay.
then we have AARP of Montana. And
Cool.
Yep.
Specific stuff.
Hi, it's Nancy Anderson from AARP. Nice to be here.
Hi, Nancy.
Nancy.
Anybody else? We have 4 that say they're from other.
The only thing I can say is when I offered my vote, it didn't register me for both the hospital and the nursing home.
Okay. Okay, well, Marcy, I'm gonna let you take over the next couple slides.
Okay. Thanks, Crystal. Can you hear me okay?
Yes.
Okay, I'll try and speak a little loud. I don't know if my speaker's working that well. So we wanted to mention the memo issued on May 18th by the Center for Medicare and Medicaid Services, or CMS, relating to the nursing home reopening recommendations. The link to the memo is noted at the top of this slide, And this was guidance created specifically for nursing homes, but the content might also be informative and helpful for assisted living facilities. We also realize we have different states on the call, and each of your facilities may be at different phases of the reopening, but we did want to highlight the information that pertains to group activities. The information I'm referencing is from attachment 1 in that memo. And again, these are recommendations. So in phase 1 is where most facilities are in a position that can be described as their highest level of vigilance, regardless of transmission within their communities. Group activities are restricted, but some activities may be conducted for COVID-19 negative or asymptomatic residents only, with social distancing, hand hygiene, and use of a cloth, face covering, or face mask. The phase 2 criteria for implementation includes no rebound cases in the community after 14 days in phase 1. There have been no new nursing home onset COVID cases in the nursing home for 14 days. The nursing home is not experiencing staff shortages and has adequate supplies of personal protective equipment and essential cleaning and disinfection supplies to care for residents. The nursing home has adequate access to testing for COVID-19, and referral hospitals have bed capacity on wards and intensive care units. Group activities, including outings, are limited for asymptomatic or COVID-19 negative residents only, with no more than 10 people and social distancing among residents, along with appropriate hand hygiene and use of a cloth, face covering, or face mask. Next slide, Crystal.
Hold on, Marcy.
Okay.
There.
There we go. All right, so in phase 3, the criteria for implementation includes no rebound cases in the community during phase 2. There have been no new nursing home onset COVID cases in the nursing home for 28 days. So that's through phases 1 and 2. And again, no staff shortages, adequate access to testing and supplies, and referral hospitals have bed capacity. So group activities, including outings, allowed for asymptomatic or COVID-19 negative residents only, with no more than the number of people where social distancing among residents can be maintained. And again, practice appropriate hand hygiene and use of a cloth, face mask, or face covering or face mask. I also wanted to mention that yesterday CMS posted a frequently asked questions document related to nursing home visitation that might also be helpful. So I will go ahead and post that link in the chat, and it includes information on facilitating outside visits, an expansion to the term compassionate care, and a reminder about allowing ombudsman access to residents. There was one question in the FAQ document, I believe it was question 4, that talked about group activities. And basically the message was that facilities may be able to offer a variety of activities while also taking the necessary precautions to prevent transmission of COVID. So if you do have any questions regarding relaxing the restrictions for group activities, we encourage everyone to check with your local or state health department officials. So at this point, I'll turn it back over to you, Crystal.
Okay, thank you, Marcy. Okay, so now let's chat. I want you to use the chat feature or go ahead and unmute yourself, but here's what I want you to do. In one word, please describe how your residents are responding to COVID-19. And again, the question is, in one word, you can only use one word, please describe how your residents are responded to COVID-19.
Lonely.
Lonely.
Oh, can you see the chat, Crystal?
Yes, I can.
So for those of you just on the phone, we're getting answers: depressed, scared, frustrated, sad, anxious, many of the things I think we expected to see. Resilient, I like that one. Bored.
Yeah.
Isolated.
Yep.
Disappointed.
Disappointed. Restless, impatient, lonely,
Frustrated.
frustrated,
Missing family.
missing family,
Confused.
confused, tolerating it,
Angry.
paranoid,
Grateful we have.
yep. Thank you for participating in that. So those are all very unsettling words. And whether you guys know it or not, you are known as what's called natural helpers. You spend most of your time with the residents and they trust you. They confide in you and they're honest with you. So for those of you in nursing homes, it's no wonder the MDS coordinators should be hunting you down. Why? You are the first to notice changes in condition, eating patterns, decline in cognition, mood, and psychosocial behaviors. You are an integral part of the team, helping keeping residents calm and giving them a sense of security. So just remember, you don't have all the answers and nobody does. So to get the conversation going today and get our batteries charged and our engines revved, I invited 3 panelists to start out the discussion. So you've met Dawn already, Brittany. So Dawn is with Wyoming Retirement Center. She's the activities director. Brittany is the activities director at Life Care Center of Casper. And Karen, are you on the line? Karen Conway, she's the activities director for Sun Heaven Assisted Living in Helena, Montana. Okay, well, Dawn and Brittany, do you want to start out the conversation of some innovative ideas that you guys have come up with in your facilities?
You want to start, Dawn?
Yep. So actually when Crystal contacted me about putting this presentation on, I think I was in the same boat as everybody else. We were pulled in so many different ways and not really being able to do activity stuff for our residents. I mean, it was down to the point of handing out face masks in the mornings and getting the face masks washed, and then we are doing our one-to-ones and then helping out in the meal times. And actually, like for the meal times, I mean, we're spending 3 to 4 hours just for breakfast and lunch doing meals and then our one-to-ones. So it was kind of like when we were supposed to try and start doing stuff for group activities, I mean, we were kind of lost. So we actually just was able to this month start to kind of do some group activities that, of course, everybody has to sit 6 feet apart and wear their masks. They can't come to the activity unless they have a mask on. On Fridays, we've been kind of really doing some cooking and having some fun, you know, like Father's Day cupcakes with fishing poles and fishes and cupcakes. And then we decorate the cart and have those go around on Fridays. And then we do, we have like an equine therapy that comes. And so we take the residents out, they have to have a mask on and of course, they're 6 feet apart. And then, so we have them seeing the miniature horses. They're really happy to have their bingo back. It's not as big, I don't think, as what we normally do, but because we can only have one at a table. We do have some that we put the little tables up, that, again, to have just one person. We do bowling and balloon badminton. I mean, people right now, we're not to the point in our facility to be able to do drives or outings, because it's only maybe one person would be able to go, but they're dying to go on the mountain, and I think also just to be able to go out to eat. So that's kind of where the frustration was with us, is what other types of activities and that. So it would be nice to have other people, when it comes time, to start sharing different activities that they are able to do. And because there's quite a few of us that are being pulled in so many different directions that we all need the help.
Thank you, Dawn. Brittany, do you want to share?
So I started out kind of like that too. You know, all of the management in our building ended up going, you know, we were each helping with meals. Nobody had a weekend off because we were here helping with meals on the weekends as well. By the time you distribute masks and get everybody out and around, you know, to where they need to be between meals and then their shower and everything else, you really didn't have time for a whole lot. But now my staff and I have kind of hit a stride. Each of the girls helps with a meal, with an assigned meal. I have some assigned meals during the week. But we do our one-to-ones, and then on Tuesdays and Thursdays we play hallway bingo because my facility doesn't have the capability to broadcast like some do. So we do hallway bingo, hall by hall. I numbered all the halls in our building, and each hallway plays. The residents play in their doorway or right next to their doorway so that they're 6 feet apart. We do the same thing with trivia because that's a really big activity in our building, not during COVID. So it was something they'd been asking for. So we brought that back. We do men's activities. We do RC car races and things like that. We also do equine therapy and pet therapy. I've got a sign up sheet for all of our office staff, and they each bring in a pet one day a week. So that we have a different critter in the building every day, different things like that, to keep it crazy. I took a poll in preparation for today's call, and our residents said that their favorite 2 things were the animal therapy, whether that equine or pet, and then our flash mob / dance parties that I actually dress up as a giant inflatable T-Rex and have all of the rest of the staff go around the building, and we blast music as loud as we possibly can and dance up and down the hallways like crazy people. We actually made Casper's News doing that. And our residents love it. They come out and they clap and they sing and they have a really good time. Other than that, our courtyards, gardening and planting, putting their feet in the grass, those have been our big helpers.
Thank you, Brittany. And Karen, were you unable to, or were you able to unmute yourself?
Are you there?
Yep.
Okay. Yes. I did have some technical difficulties, but I think we figured them out. Like you, outside, we're doing a ton of walking with the mask. The residents don't really care for that, but if it's one way to get out and do some exercise, they're loving that. Animal therapy, again, like Brittany, that seems to be a huge thing. We do, I do nail time, and the men are really liking that. It's one-on-one. You go from room to room. Of course, you're masked, and do more of a spa thing. The other thing is we do kind of like a relaxation station. It's one-on-one. It gives the residents the touch. Spa music is played, and just pampering them with neck massages, facial massages, and just loving on them. So those seem to be a huge thing that they're really enjoying. Of course, we're doing water, you know, just a pool outside. We're in the heat wave right now, so they're also liking that. It gives them deck time and you know, toes in the sand, so to speak, toes in the water. Gardening, again, is huge here, but lawn darts, which aren't really lawn darts, just going outside and doing that type of thing are big. Doing a little bit of armchair travel. We do a little cooking, cuisine with our residents. Last week we traveled to Greece and we did some Greek cookies in the morning, and then we traveled to Greece after that. Birding, we've done some birding where they let me know what kind of birds they like. I will upload pictures and we kind of do like a discussion about that, and have had some different things that we've done with that, different noises that birds make, call them up on your phone, that type of thing. They really seem to like that. The other thing we're doing is dancercise. It's still social distancing, but you know, hanging out, having fun.
And was it your assisted living facility that we're painting rocks? I think that we spoke about? Was it you?
Yes, they did. Kindness rocks, and we stuck them outside on our walks, and it was kind of a big draw because we did have some of them picked up, and so there was chat about that. But it was nice. They got all kinds of excited on that, and then we've done it twice since then, and I've taken them on my walks and dropped them off and kind of give them feedback too, not just around the facility, but also in my area. And, you know, they disappear, and the residents are really liking that. They're spreading joy.
Well, thank you, Karen.
You're welcome.
So there is a question in chat about the pets, and does the animal rule vary by state? In Alaska, I was told I couldn't bring my dog and we had to have an employee take home our resident cat for the time being.
Do we have any administrators on the line that could help answer that question? Because I have heard Wyoming nursing homes, they are still bringing in pets. Some facilities are doing that.
So this is Marla Sandvik. I'm the administrator at Sydney Health Center Extended Care in City, Montana, and we have a resident cat that lives in our facility, and he's older and he doesn't go into too many rooms, but I have not restricted him at all from being in the facility. I have restricted we had some staff members bring in animals, their dogs, etc. But we did restrict that shortly after all the restrictions did come down in March. But as far as our resident cat, he lives here, doesn't go anywhere. So we didn't feel that the information provided by the CDC in terms of animals being able to get and transfer COVID-19, that it was a big risk for us. So Simba lives here and stays here.
Okay. And maybe that's what I'm thinking, that they are facility pets. So anybody else on the line want to share if they are allowing pets, or do they know the regulations with that?
At our facility at Ponderay Medical Center, and this is Joanne Cobb with the Life Enrichment Department, I'm the manager here. We have taken our resident dog home. He stays with me now, and he's not been allowed to visit since we aren't having group activities due to the fact that they're concerned about him wandering from one room to the other and possibly transmitting an undesirable infection of any kind, so especially COVID. We are doing all our meals in the rooms. We do one-to-ones, we do readings, daily devotionals, we read Chicken Soup for the Soul. We have birds in some of the resident rooms, and they stay in their rooms, and so they aren't transmitting by going to other rooms. We do some bread baking so that they're sensory to smell, and we serve it during treat time. We aren't doing coffee social, but rather treat time, which is in their rooms. We do hall bingo. We have a wireless system, and we're able to bring a speaker down the halls and read out the numbers for the residents that want to play, and that seems to go over very well. We do it 6 times a week. So Monday through Saturdays. We do it in Hall 1, Hall 3, and our special care unit. We have had gardening, and so they planted petunias, and we do one-to-ones like going out and watering the variety of raised flower beds with strawberries and our flowers, and do walks outside. We have a quite a extensive garden with a walking path that they do. We paint in the rooms. We do one-on-one art classes, and they get their newspapers and reading. We do coloring. We have an opportunity to do word searches, crosswords, word jumble, that kind of thing. And we go around in the morning and we do one-to-ones where we greet them for the day, tell them what the weather's going to be like, ask them if they need anything, and bring them coffee. So we do, after their breakfast meal, we bring them around an additional cup of coffee or tea or hot chocolate if they'd like, and just ask them if they'd like to have some music on or that kind of thing, and visit with them about the variety of their families. We do Zoom, Skype, FaceTime, emails. We print off pictures of the variety of residents' families for them. They email us and we download their messages and pictures. We stay pretty active as far as wiping everything down. The bingo boards are all wiped down in between. They have their own bingo pieces that cover the board that are in their own Ziploc bags, and we sterilize all those in Clorox. We observe the holidays by bringing around, we did bouquets of flowers for the ladies for Mother's Day, and for Father's Day we did little treat jars. The auxiliary ladies participated in bringing them to the facility, and then we wiped them all down, incubated the flowers for 24 hours before delivering them. We offered the gentlemen ice cream sundaes on Father's Day, and the ladies had angel food cake and I can't remember, but for Mother's Day.
Yeah.
And then we did the Memorial Day. We did red, white, and blue for Memorial Day and for Flag Day. Tried to observe that. We do the national recognition days, and we go around and announce what those were. So like if it's peanut butter cookie day, then we provide peanut butter cookies, talk to them about what's going on in the community. We have events that, have been going on or not been going on. They loved playing the trivia game, the what do you call it? The Wheel of Fortune.
Yeah.
Name that tune. They love to play Name That Tune, and to do the bingo with the social distancing in the main dining room. But then we haven't been able to do that since like March 15th, I think it is. So it's been a long time, but they liked that even with our tables socially distanced and them staying, separate from each other. They really enjoyed doing those types of games, turning them into kind of a Hall 1 got so many words right in the word search, and Hall 3 got so many right, and they get a kick out of that. We do have a vegetable garden, and different ones go out and they have different rows of vegetables that they take care of, and they do enjoy that. The hail was really a bummer for them. They do have a machine out an exercise machine out in our dining room now that they're able to sit and try to keep up with their exercising, and they do that one-to-one, and that's all wiped down in between each person, and they're all masked when they come out to do that. So I had used the word disappointed because we had been so diligent in keeping the 6-foot distancing and masks on to do some social things that were, like the bingo or the word search or the games out in the main dining room. But since we haven't been able to do that, and we have them in their rooms most of the time, it is disappointing to them because some of them were afraid that they didn't even know who might have passed away during this time because they're like, well, is so-and-so still even alive, kind of thing. So that was hard on them, that. Mm-hmm. Thank you.
Yeah, thank you for sharing all that.
Thank you.
Crystal, there is a question in chat asking what app or website do you use for interactive game shows?
All right, well, we will find that out for you. I'm not sure.
And there is also a comment in chat. Our building our Build a Sunday activity has been a hit. We take a cart around the hall with ice cream and toppings, and they get to tell us what they want on their Sunday and then deliver it to their rooms.
Oh.
Great idea. And then we also have another idea for everyone. If your facility allows for it, we have been doing parking lot picnics with our family members and residents. Family members stay in their car while the resident sits at the table 6 feet from the driver's side of the vehicle. And the kitchen makes up lunch for everyone, and it's a really neat experience to the residents and family. And we have heard lots of kudos from our family members. So that's from Highgate Senior Living. So thank you.
Yeah, that's awesome.
Oh, go ahead, Crystal.
Has anyone done any parades or drive-bys? I've heard that for high school students, things like that, but are you guys doing that for the residents? We have, okay.
We do the parades. We've done one for Father's Day and for Mother's Day where we have family members come and decorate their cars, and our building has a whole loop of road that goes around it. So everybody comes and honks and waves, and it's crazy. For Mother's Day, everyone was crying. It was wonderful. I was leading the parade, and my car was crazy, but everybody was crying. It was so amazing and wonderful. And then to answer the game show question, we use iPads, and you can download interactive games like Wheel of Fortune and all of that on your iPad, as long as your facility has one. I know you can apply for grants for those. But we've been using iPads to do those things, and then projecting it up onto a TV with a Fire Stick or an HDMI cable.
And I'm seeing someone did a sunset cruise with mocktails and fun refreshments. Good idea. We did a Mother's Day parade, and we are getting ready to do a car show via, oh, that's a good one, a car show via parade. We have a classic car show that came by and, oh shoot, the chat's going so fast, drove through our parking lot at the end. The residents really enjoyed that. Oh, so car show, did you get with the car club to help facilitate that, Laura? Okay. We had a classic car group that came through. The residents loved that. We had a 101st birthday drive-by for residents last week.
And then kind of on the flip side, there was a comment from Kelly about maybe the family members enjoying the parades more than the residents. So
okay. How about dining? With the residents 6 feet apart, what are you guys doing? Because it would be hard to yell across the room, especially if your residents are hard of hearing, and you still want to have that dining experience for them. Any clever ideas that have come forth in the dining and the social isolation or the social distancing?
Here in Buffalo at the Veterans Home, we have 78 residents. Our dining staff divided them into 3 groups. So we have 3 different dining times, and there's about 25 or so in each group, so that they can sit just 1 or maybe 2 people at a table and practice their social distancing as they come through the line as well. That's worked out really well for them. We also set up, because we are assisted living, they're used to going out shopping on their own, and we take them shopping weekly as well. But we developed our Veterans Home of Wyoming canteen so that they could come down and buy some of their favorite snacks and goodies that they're used to getting on their own. That has helped tremendously to relieve some of the stress and tension that was built up. We've been doing that now for 3 months. We have the store twice a week that's open, and they also come to the store in their dining room groups so that we don't have everybody down there at once. They've been very good about keeping their distance and coming down at their designated times with their groups, and it's really made a difference up here. Also with our assisted living, with our residents, we have a large facility. They can go out for walks. We have a wonderful little pond. They go down fishing. We don't have any volunteers or family coming in to visit, but we have taken over some of the volunteer activities that had been going on. My assistant and I do the bingo twice a month for the VFW and the American Legion. We hold weekly ice cream socials. We did a banana split social one week that went really well. We also held a fishing derby down at our pond that one of our veterans groups usually sponsors. So since they couldn't come, we went ahead and did a fishing derby on our own with our residents. And that was a lot of fun. But it's interesting to hear all of your drive-throughs and your pet therapy and stuff, because we've not been allowed to have any volunteers or outsiders come into the facility since March. So but we are keeping busy with resident and staff activities where we can keep separate. Our cornhole competition and pool, it's been interesting.
There is a question in chat about, oh, I just lost it, about using real money in your store. So whoever commented to that, are you guys using real money?
Yes, they have to purchase the items. We have a plan in place with one of our local grocery stores. We purchase items from them, and whatever they charge us, we charge the residents. So there's just an even exchange there. But they do have to purchase their own products.
Root beer floats seem to be quite popular.
We do that once a month.
Remote control car races in hallway. Oh, that's a good idea. Thanks for sharing that, Susie. Okay, well, it seems like we're slowing down a little bit, so we're losing some steam. So just kind of, here's one of the handouts that we're gonna send along with everything today, and it's how to simplify and explain what coronavirus is, how it's spread, how it's treated, what are the symptoms, and how can we prevent it. So I know you guys have had a lot of questions from residents, family members. So this is quick, easy, and it's very simple to read. So not a lot of medical jargon in there. And so if you want to put that in your family newsletters, hang around your facility, or just have on hand, you're more than welcome to this handout. And then the next one is take care of yourself. Protect your mental health, get regular exercise. You guys all know this, but you need to make your your healthcare a priority as well. So we are going to send off these 2 handouts as well. Here's from Marcy. Do Montana, Alaska, and Hawaii have state activities coordinators association like Wyoming?
And then just a follow-up question for Dawn. Dawn, you mentioned the Wyoming Activities Coordinator Association that has a Facebook page. Do you have a website?
We do not right now have a website. Brittany is actually, the IT position is actually new this year. So Brittany's got all sorts of fun ideas and that to start working on. And the website is actually one of the things that she is going to be working on. And then when we're getting ready to have a board meeting at the end of next month, hopefully she'll have good information to see how we can build our website and stuff like that. So
Dawn, do you want to put your email in chat? It looks like you guys are the only association for the state. So I'm sure we have some people out there that would love to pioneer that and get those going in the states that they don't have them.
And also kind of a question for people, because I know with a lot of facilities are doing the family outdoor visits, ideas for people for the dementia unit people. How are you guys doing making sure that everybody stays 6 feet apart? We have not started that yet because we are waiting for all of our test results to come back for the staff. But I have a lot of concerns where your dementia people are not going to be able to understand the 6-foot rule. I've had family members that say, I don't know if I can abide by those because I just really want to give my mom a hug. And so it kind of puts people in an awkward spot. So I would really like to have some feedback on what other facilities are doing with that.
Dawn, we haven't started those visits yet, but our plan is to build plexiglass boxes for our residents to sit in that are equipped with fans because it's hot, as we all know. That way we can kind of help negate the option for them to touch each other. But that's our plan.
That because I have brought that up, and our administrator said that there's a lot of places that they've been asked to take the plexiglass down. And so, and I'm on like an activity page on Facebook, and there's a lot of places that are saying, what are you guys doing? Because we've been asked, you can't have barriers and stuff like that, because it really defeats the purpose
of the visit.
Distancing and being, that's why it's outside. So.
Gotcha.
Lots of
what if you were to use viscane plastic?
What was that?
If you use viscane plastic to separate the resident from their family member.
Yeah, I don't know. I know I had brought it up to our administrator because I had thought about the plastic. It could be a clear plastic because we're doing it out in gazebo anyway, so it's all cleaned in and everything. And yeah, it didn't go well with the plastic. So
yeah, see, because we haven't started ours yet either, and that was my thought, is putting the plastic up there.
Yeah. And I don't know if people just don't, it's not to keep the infection away. And that's what I explained here at my facility is it's not to keep germs and all that. It's just to keep the social distancing for people that don't have the capability of understanding that. So the only thing so far that we've come up with is, especially our dementia people, is kind of definitely set strong boundaries onto the fact of if they start moving around and start getting antsy and not, we're going to have to kind of start chasing them around kind of, then the meeting is over. And so,
Right.
yeah.
Hey, Dawn, this is Marcy. We have something in chat, and I was going to ask this too. What is the name of your Facebook page for your activities association?
It's the Wyoming Activities Coordinators Association, and then it will come up as that with WACA. So.
Okay.
Yep.
Thank you.
Dawn, and I'll pull up a picture though so they can see what it looks like.
Thank you.
This is Joanne Cobb again. I forgot to mention in the mornings we do beauty time with all the ladies that want to, and we curl hair and put on makeup one-to-one. We are not allowed any group activities, so that makes it hard, but we do family visits through the window of their room with their, we get the phone and they can listen to them on the phone and they wave at them and do phone chats through the window and seeing them, and that seems to help a lot. So we're doing a lot of different one-to-one type activities that are more personalized care, painting fingernails and spending time with them that way. And we're just looking forward to a time when they can visit their families again.
How does everyone handle haircuts for their people?
We
So
have not been able to do those yet because we're not allowing our hairdresser back in the building just yet.
So
We
here at the
haven't either.
Retirement Center, sorry, Mary Sue, we have one of my activity staff people have actually, she's went to school and done the cosmetology, but has not taken her test. So I had to email everybody and call everybody and see and get permission to see if it was okay. So that's another thing we added to our calendar. So also just kind of I keep all of our one-to-ones and Zoom calls and everything else on a Google Calendar to keep track for us to keep it straight. And then also just in case, the state people come in during survey time and ask, how are you coordinating this? And so I can pull up the last, 3 months worth of Zoom calls and everything else that's on the Google Calendar. But I also shared it with the rest of the facility managers because it almost feels like instead of coming and hunting us down and saying, hey, can you take so-and-so for a walk? They can pull it up on the Google Calendar, one, and see if they're on there for a walk or actually see if we are even available to do that. But yeah, so for haircuts, activities is taking care of that also.
That's what we're doing here too. Activities is taking it over.
Well, we are at the top of the hour, and I would like to thank all the interaction today. And I'm getting a lot of comments via chat and privately that this was a very good idea and very helpful. So I'm glad you guys felt it was worthwhile the hour that we were on together. And again, we're going to compile all this information into a nice handout to give to you for future use. So again, thank you all for getting on and have a wonderful weekend.
Thank you.
Before everybody jumps off, I didn't have a break in there to hop in. I'm from the Kimmer Nursing Home here in Wyoming. One really cool thing I thought that maybe you guys could use, we have a Girl Scout and Boy Scout group that's going to come and build a plywood sign outside of one of our windows that has a plexiglass cover where all the families can put little posters or notes and fun little pictures and stuff, and then they can have them up there for 1 week total, and then we'll switch them out, and just a place where the residents can see notes and pictures and stuff, and the family can just come up whenever they want and hang it on that board.
That's a good idea.
Yeah. And then one other thing that we do a lot is fishing for snacks. So we have a little plastic pool we take down the hall and some little fishing pools, and we put pipe cleaner hook on the fishing pole and pipe cleaner loops on all the snacks, and they can throw the hook in there and catch a snack.
That's a good idea. That's a really good idea.
So those are just a couple things I thought you could use before we hop off.
Thank
Something
you.
we've done for the men also is some model cars that snap together for them to take time to build. And they like those and jigsaw puzzles in their rooms as well. Thank you for sharing, everyone. There's been a lot of good ideas.
Yeah, I thought so too. So I can't wait to see what comes out of it, you guys. Bye, everyone.
Thank you.
Bye, thank you.
Discussion.
Bye. Thank you.